Cystic fibrosis is an inherited condition causing sticky mucus to build up in the lungs and digestive system. Children with cystic fibrosis have frequent chest infections and often need admissions to hospitals for IV antibiotics and intensive physiotherapy sessions. These admissions usually last between 1 and 3 weeks, and some children with CF need to be admitted for IV antibiotics every 3 months. These children are very unwell, they are on multiple medications, many of these affect their appetite. Added to this, they have extremely high calorie requirements as their bodies are fighting infection. These frequent admissions, as you can imagine, are very disruptive to their day-to-day life and routine. Most children with cystic fibrosis have difficulty digesting food and need to take pancreatic enzymes, called creon, with everything that they eat and drink and with milky drinks. The amount of creon needed depends on what they are actually going to eat and the amount of fat in the food. If they don't take enough creon, they won't be able to absorb the nutrients in the food and will have symptoms such as abdominal pain, wind and quite explosive diarrhoea. And all the nourishment from the food will literally go down the toilet. As a dietitian, my role is to make sure these children are getting the nutrition they need to promote their recovery and to achieve the weight gain that they need, as well as making sure that they take the right amount of enzymes based on what they are eating and drinking. These children need to have meals and snacks that are varied and nutritious, as well as being appetising. The meals and snacks need to be high in energy so these children can get the extra calories they need to fight infection. And these foods might not always be thought of as healthy eating. The menu needs to be sufficiently varied to avoid monotony associated with frequent lengthy admissions. In addition to varied meals that are freshly cooked on site, these children need to have access to a wide range of high energy snacks to enable them to meet their extremely high energy requirements. They also need to have a good supply of healthy snacks, including fresh fruit and vegetables, to make sure their gut works properly. Meals need to be cooked to a standard that allows the dietitian, the child and their parents to be able to calculate how much creon they need to take with these meals, and that will be based on the fat content of the meal. Now, for children with diabetes, in Addenbrooke we care for children with different types of diabetes, but mainly type 1 diabetes. And this is a chronic condition in which the pancreas produces little or no insulin, and therefore the insulin must be replaced. The insulin is required for utilising carbohydrates to make energy from the food that we eat. Because of this, the carbohydrate counting is a very important part of diabetes treatment. There's no special diet for children with type 1 diabetes, but a balanced, healthy, varied diet is recommended. And it's important that the low carbohydrate snacks are available for children on the ward, as well as what they call low glycemic index carbohydrate sources. In order to work out the insulin dose for each meal and snack, the nutrition information of the carbohydrate content must be provided, as well as the portion size of the carbohydrate source, and also they need to have access to food weighing scales. As insulin must be injected prior to the intake, it's important to have this information available to patients and parents before meals and snacks are given to the patient.